Welcome, everybody, to our workshop on how to prevent and recover from common sports injuries. So basically, how do we end those nagging sports injuries now? That's what we're going to cover. And so tonight, you may be in a category of people where, maybe you're missing workouts right now because of some old chronic injury or a new acute injury. Or maybe that's happened to you in the past and you want to prevent it from happening in the future and happening again. Or maybe you've seen others that it has affected and you want to be proactive and you want to learn how you can prevent sports injuries from occurring. So we're going to be covering all of that. And we're going to be sharing information that'll be useful to everyone across the board, from kind of the weekend warriors that are just starting to get back out and now that the weather's nice and get back into summer sports, that kind of thing, all the way to those that are on it throughout the whole year and they just want to keep increasing and improving their performance and they don't want injuries to get in the way. So we're going to do all of that tonight. And if you have started to miss workouts, or you are feeling a bit of despair over these chronic injuries that just don't go away, and you're starting to live around it, and you're avoiding certain things, or you're just compensating in other ways, and maybe you're getting a bit disheartened, don't give up, don't quit, because there's something that we can do about it. And we just have to understand what this pesky problem is, what the cause of it is. Why is it that your body's not able to recover the way that you really would like it to? And once we can reconcile what is getting in the way, then we can get you back on that road to recovery and back to that level of activity and fitness that you really strive for. So we have to just get to the bottom of it all. And don't just say that you're getting old either, because that excuse doesn't actually have a place in our office. It's not about getting old. Don't throw the towel in. And definitely don't start ignoring what's going on either, because when you ignore a problem, it's just going to get worse over time. So instead, let's just jump right into this. There is something that you can do about it. Let's get you back in the gym, back on the field, back on the track, back in shape for summer. You've got time now to correct the problems and recover and then get back into summer shape. So let's jump right in here. And by the way, this is one in a series that we do over the whole year, and it's all part of the Body Signals series. And next month, we actually have a very much related topic, which is Inflammation Nation. And you'll see, we're going to touch on it tonight, because chronic inflammation can come from lifestyle choices that we're making. And if you don't understand how to get that, then you're never going to actually be able to go after these chronic injuries. So it is a big part of it, but I don't want to just go surface with it. I want to go deep. And so please join us next month. And we're going to dive deep into the whole category, the whole topic of inflammation, so you can really understand it and know how to get a handle around it and then prevent it, so that you can be living that fullest life that you want to be living. So when it comes to, here, let me just make sure that this advances here. There we go. So Inflammation Nation, that'll be next month. And it's all about this silent attack on the modern human lifestyle. I just want to do one thing here to shift this. We'll get it. Just a moment. There we go. All right. So now we're going to jump right into our topic of this evening. And let's really break this down, because we have to look at it in different pieces to really understand it. If you're talking about performance, better performance is always going to be based on three things. So we have to look at, and it really doesn't matter what activity you're talking about either, whether it's hiking or biking or running or tennis or golf or basketball, football, soccer, rugby, ultimate frisbee, horseback riding, yoga, Pilates, CrossFit, pickleball. Your performance is always going to be based on these three things: your technique, your programming, and your recovery. Now, that's where coaches come in. Coaches are the experts on technique, and that's what their job is to watch how you are performing different maneuvers so that you get your technique right. And that's where your greatest performance is going to come from, is having really good technique. Now, programming is where you have these workouts you've created, and these again, programs for the athlete, the coach can do this, and they can take you through a whole series so that you're working on certain muscle groups, you're working on certain skills, and so on, speed, accuracy, and there's programs you can do for that. Uh, but then there comes to recovery, and this is where I fill in here. I am the recovery expert. This is where I fit as part of the team. I'm not the coach, I'm not the trainer, but I'm the on the recovery team. And when it comes to recovery, really it's going to be about these pieces here. So we have to look at rest. Now, you know the idea of with exercise, you're one day on and one day off. So you have that rest in between your workouts so that you have a time to recover. Sleep would also be in this category, making sure you're getting good rest at night when your body is healing from tissues that have been stretched and strained. And so that's how they build into stronger muscles. And that is, again, sleep is a really important time for recovery. And so rest is going to be not just in between workouts, but at night as well. When we look at the category of fuel, of course, this is going to be both for performance, but also for recovery. So looking at anti-inflammatory diets and Paleolithic lifestyles. And we do other workshops where we dive deep into this, but needless to say, we're not going to ignore that this is part of being able to recover, is having the right building blocks and nutrients for your body to be able to rebuild that tissue. When it comes to care, we have self-care, which is you doing the foam rolling, the stretching, the icing, the warming up before, during, and after workouts. But then there's professional care. And what I mean by that is working with massage therapists, physical therapists, athletic trainers, and chiropractors. That's where we fit in. When we look at all of these other pieces here, now, this is just breaking it all down so that I just want to move. There we go. I want to just set this up so that it doesn't block. Here we go. That's better. So when we look at problems and faults, where you may have actual injuries that you're trying to recover from, or you may have actually movement faults that may not even be symptomatic, but are setting you up for a lower level of performance and potentially at risk of future injuries. So let me tell you more about what I mean by this. Whether it's an acute or a chronic injury, in any case, things can lead to injuries, and all of it can impact performance. And the three areas are going to be in technique, so knowledge. So, for example, how to do a squat properly. Like you could just go and bounce out some squats, but if your technique isn't right, you could be injuring your knees and you could be injuring other parts. So you want to have good technique on just how to do it. A coaching cue for a squat might be make sure you're gripping the floor, pushing your feet apart, like you're tearing newspaper apart. Like those kinds of nuances and technique can make all the difference in getting the most benefit from a workout or an exercise that you're doing. Then we can look at fitness. So fitness is going to be strength and flexibility. So you might know how to do something, how to have good technique on something, but you may not have the strength to accomplish that or the flexibility to accomplish it properly. And so you may know how to do it, but you may still be off balance or something like that. So your coach can help you here as well. But you could also be an athlete that knows your technique and you still have these faults in your biomechanics, and that's going to affect your function. So you could have a structural subluxated sacroiliac joint where the left side is pulling as you do a squat and gets you off track and limits your depth. The coach could yell at you all day long about your technique, and you could try foam rolling the hell out of it, but if it's a structural or neurological fault, it's just going to persist. And when it's neurological, if it's not addressed, it means you're going to start training around it. And then this is just going to lead to poorer performance, increased risk of either acute injuries or breaking down over time. And that can lead to chronic degenerative change as well, or both. So chiropractic here is the solution to this. And this is where I'm an expert in movement patterns. And this is what can lead to better training, better performance, and better outcomes is if you do take care of this. So how do we evaluate whether you have things in your biomechanics that are off that are going to affect your performance? We can just start by looking at your posture. So even just looking at static posture, when you stand, is the center of your head over the center of your shoulders? Is the center of your shoulders over the center of your hips, center of the hips over your ankles? Like that's the question that we want to be asking. If you have even just static posture, when you're actually paying attention to it, can you achieve this? Now, I know when we go unconscious, we might go into a slump and that kind of thing, but I've literally take posture analysis of people. They know they're having their posture analyzed and they still can't even achieve this with everything lined up. So what's going to happen if you start to put them now into movement postures and postures under load, where now the neurological and the structural could get in the way? So if someone thinks they have a great posture, but they don't, we've got to actually address that even at the most basic level. Once you do have this assessment of really good static posture, then we can look at it under load. So if you were to do like a deadlift, well, that adds extra weight to the posture. And so postural deviations are going to get exaggerated. And this is then what can lead to degenerative changes, breakdown, and injury. Now, if we then add movement to it, this is going to exaggerate it even more. And so this overhead deadlift squat, it's the hardest thing to do because you have to have really good posture, really good proprioception of knowing exactly where your body's in space. You have to have the strength, of course, but you have to have the flexibility as well to be able to do this. So there are different ways that we can assess this. Some athletes have shown me videos that we can look at with them working it. Sometimes we just watch them do certain exercises. But if this is off and we can see the postural issues exaggerated, that's when performance is going to be hindered and it's going to promote injury. But it is correctable. And so athletes that are looking fine-tuned at all of this, this is where we can really move the dial. So when we look at all these problems, they are correctable. And so the first thing that I need to understand is what the true problem is. What challenges are athletes having? How it is affecting their performance or their life? Are they aware of and even concerned about future breakdown? Sometimes athletes are not. They think they're going to just power through it. So we start with a functional survey. And once we do that functional survey, then we do a functional assessment so we can understand what's going on and what we need to take into consideration to correct their faults. We can work with their coach on technique and fitness, and we can address the biomechanics with the care that we provide here. Now, if any of you are interested in the functional survey, if you're watching this recording and you're curious about it, just let me know in the chat box. But otherwise, you can actually just send us a text. And if you just text our number, it's 802-985-9850. If you text us and just say you want to set up a consult, we can actually even do a virtual consult as well. And that way we can really find out whether or not you have any of these things that need to be corrected. So if you've put into the text, when you text us, just send us a text that says functional survey, and then we'll send that survey to you. And that way you can take the survey and then we'll be ahead of the game. We'll have that info on you so we can dial in when we do have our consultation. And then that from there is where we do our functional assessment and we really can understand what's going on. And so when we look at this whole idea of, our lifestyle is what's creating these problems. It's our lifestyle that's doing that. Can I just go back for 1 second here? Yeah, okay, got it. So when we go through what are the things that are causing the problem, it's our modern lifestyle. It is totally engineered to be unnaturally unhealthy. And a lot of that comes from the postures that we're in all day long in our daily activities, whether it's our work, the studying that we do as students, or even if you're a lifetime learner like me, when I'm studying something, I tend to look right down at it and get engaged and forget about my posture. Even things like just grooming and self-care, what happens to our posture? And then we get to the actual sports that we're doing, socializing, driving, eating, sometimes even sleeping, we get the couch potato, right? You fall asleep on the couch and look at how that's affecting the posture. So every one of these folks, what do they have in common? It's poor posture in every activity. So when we spend so much time in this hunched forward posture, it leads to deconditioning of all of the extensor posture muscles in the back of the neck, the shoulders, and the mid back. And remember, with the upper extremity, it's primarily a muscular joint. So if those muscles become weakened, what do you think is going to happen to the joint? It's going to break down over time. And then this poor posture, it's not just going to affect the upper extremity because those extensor posture muscles go right down your back. And believe it or not, there's actually a whole posterior kinetic chain that goes from the base of your skull all the way down to your ankles. And so all that needs to be working together. And if we start to find that right in the middle of it, those extensor muscles in the back are getting weak, it actually affects everything. So upper and lower extremity. And so improper posture is one of the primary causes of a lot of athletic injuries that goes unnoticed. It goes under the radar. And one of the reasons is that there is something that can happen when we have overload in the spine, whether it's from jarring events like sports injuries, but also car accidents or slips or falls, things that jar the spine and the nervous system, but also bad habits and poor posture in between those events. And those coupled together accumulate, and they can lead to something called subluxation. So a subluxation is when, and this is many people are not even familiar with what a subluxation is, but it's from traumas or jarring of the spine coupled with the bad habits. And so the joints can misalign, and that can then cause soft tissue to be damaged. And then that creates nerve irritation, and that can even cause the disc to swell up and the nerves to be irritated. And remember, the nerves are then, they tell the body, your smart body, to strap that joint down to try and stabilize that joint because it's irritating the nerve and the discs anytime it moves. So it tightens up the muscles and even spasms them, trying to protect that joint. When that happens, we have lost imbibition. So imbibition is similar to how a sponge works. When you squeeze a sponge, it squishes the water out, and when you release it, it sucks the water back in. That's how the discs get all of their nutrients in and their toxins out. Discs do not have a good blood supply, and so they rely on this process of imbibition in order to get the toxins out and the nutrients in. And so when we spasm that muscle and we lock that joint down, there's no longer movement, and then the disc can start to degenerate, and we can get fixations in the joints, and we can get degenerative changes in the joints in the spine and the discs as well. So the disc, it's not like a hockey puck. It's actually a complex organ that acts as a spacer, so the nerves have room to breathe to carry the messages going back and forth between the brain and the body. And when that disc degenerates, we also could call that degenerative arthritis. Oftentimes it's called normal aging, but it's not. It's actually due to long-term uncorrected subluxations. Now, I don't have time to address every extremity injury that happens that I see, but I'm going to go with the big ones that I tend to see. And we're going to start with the upper extremity. Now, the upper extremity is an open kinetic chain. It means it's non-weight bearing. I mean, unless you're doing a handstand and that shoulder then the upper extremity becomes, load bearing, then it would turn into momentarily, temporarily, it would turn into that more of a closed kinetic chain. But all in all, most of the time we're upright. And so we think of that upper extremity as an open kinetic chain. And what we gain from that is we have the mobility and the movement in our ranges of motion without it being locked up and limited by being in more of a closed joint. What we lose, however, is we lose stability and protection. And so you're actually more susceptible to injury in the shoulder, the elbow, and the wrist because it is an open kinetic chain. If we look at the upper extremity, it is consisting of this shoulder joint, which would include the acromioclavicular joint. So that's this joint right here, acromioclavicular. The acromion process is the scapula, the wing bone on the back that comes up to a point right on the shoulder, and that connects to the clavicle or the collarbone that goes across the front of the shoulder. So the AC joint is right out at the tip of the shoulder. The sternoclavicular joint is where the clavicle or the collarbone interfaces with the sternum, which is the breastbone right in the middle. That's the SC or sternoclavicular joint. And then around the back, we have the scapula itself and all the soft tissue around the scapula. And then we have the glenohumeral joint, part of the joint, which is the humerus is the the arm bone itself, and then the glenoid fossa is the where it fits in. So that's the glenohumeral joint. And we have the deltoids, which are the power muscles that are that round muscle that comes off the side of the shoulder down the arm. And then we have the rotator cuff, which is all the other muscles that are there to stabilize that joint so that the deltoid can do that power move that it needs to, but it needs to have this joint be nice and tight, meaning like a claw of an eagle around a ball, that it needs to be working efficiently. If this joint gets sloppy, then the deltoid is going to lose its power and you're going to be more susceptible to injury. And that sloppiness can come from injuries, or it can come from a lack of integrity in these muscles and ligaments and tendons because of interference in the nervous system that is in charge of controlling those body parts. Going down from the shoulder, we have the elbow, from there, the wrist, and then the joints in the hand. And so all of those things are being innervated by the nervous system, which sends messages from the brain out through the nerves to go to every body part, every part in the body. Every tissue cell in the body has a range of 3 to 9 nerve cells going to it. So all these muscles and tendons, but the bone cells as well, every cell in the body has nerve fibers going to it. And so when we start to look at what are the issues in the upper extremity, well, it turns out that the root cause of many of these is subluxation. And so that can actually mean that trouble in the upper extremity, whether it's the hand, wrist, elbow, arm, or shoulder, can actually be coming from the neck. So remember that posture is going to be a problem here if subluxations in the neck are causing these upper extremity issues. And I have to tell you that I have seen in younger and younger ages more and more trouble with posture, and it's leading to more and more trouble with upper extremity issues. And so this next generation's in trouble because they're a generation that now has these devices in their hands all the time, and they're looking down at them, and it's affecting their posture. So tech neck is a real problem. In fact, it's in pandemic proportions that we have this tech neck happening. We have to reconcile it, or this next generation really is in trouble. So when we have upper extremity issues, again, they usually start in the neck. And so some of the things that we find associated with neck issues and symptoms would be neck pain and stiffness, muscle spasms, lost range of motion in the neck, joints popping and snapping, arthritic changes in the neck. But far more commonly, there may be no outward symptoms in the neck at all, kind of like dental issues. These problems can begin asymptomatically, meaning silently, and they can go undetected and they can get worse for years if they're not caught. I had a fellow come in just a few months ago. He was actually complaining of low back pain. We took some x-rays of his spine and he had no complaints about his neck, but he had moderate degenerative change already setting in there. So again, we were able to get to work on that right away. But again, most of the time, these can actually go undetected. So we need to get to the root of the problem, which is in the neck. And once we get there, then the real healing can actually start to happen. And it's a 3-step process. It's very correctable. We first have to stabilize, then we rebuild, and then we optimize. When we look at the neck, the reason why the neck is the cause many times of upper extremity problems is because we have to look at the nerve supply and where it goes. So the bones in the neck, the ones that affect the upper extremity are going to be usually from C5 to T1. So we have 7 cervical vertebrae. The first one is right underneath the skull. Number 2, number 3, number 4, but then number 5, 6, and 7 are in the lower part of the neck. And then T1 is the first thoracic vertebrae at the top of the back. So it's the C5 to T1 area where we have the brachial plexus coming out from the neck. And these are the nerves that come out from each individual vertebrae in between them. And then they join together into a plexus that then goes down the arm, innervating everything from there down into the neck, the shoulder, the upper arm, the forearm, all the way down to the hands and the fingers. So this is the primary communication that is feeding the upper extremity. And remember, this information is going in both directions. So we have information going from the brain out through the neck down to the upper extremity, all the way down to the fingers. But we also have information coming back along those nerves that are going to be supplying information back to the brain to tell the brain what's happening in the body. So it's a cycle where the information is going out and it's also coming back in. And I will tell you that the information coming back in is sometimes even more important if it gets distorted than the information going out. This plexus, if we were to just cut off the shoulder, we would actually see wires coming out of the neck to keep all this tissue healthy and healing. All the blood supply, the lymph, and all that tissue, it's all controlled by the nerves. And so, how do we see people presenting? Well, we might have like an older gentleman who has been a farmer, for example. So I've certainly had those in my practice. And they have this degenerative change that's gotten started from uncorrected subluxations, and it's starting to affect the strength in their upper extremity, shoulder problems that they have that they're not recovering from, that kind of thing. I also have a lot of dental hygienists in my practice. And I had one woman who actually fractured her arm, and she was going through PT, so it would try to get it to heal as fast as possible. And she absolutely noticed that when she would have a certain plateau with PT, she'd come in, she'd get adjusted, and immediately after the adjustment, she suddenly would have more function available. And so again, it's because we cleared the nerve interference. Another example of a carpenter. Now, carpenters they are occupational athletes. They are just like the farmer. They are using their bodies. And I would say, just like this dental hygienist, they're occupational athletes as well. They have to have their bodies working for them so that they can get their work done and they can stay in the career that they have. So I had a carpenter who had wrist, elbow, and shoulder problems. And he had even had some surgery on his shoulder, had gone through a long recovery period, had lost a lot of atrophy in the muscles. So the actual size and function of the muscles had dropped. And so we just started to work with him and cleared that nerve interference. And he was able to regain all of that strength and continue on for years in his chosen profession as a carpenter. And he was able to just stay consistent in his work. When injuries occurred, he would come in, get adjusted on a regular basis. And those injuries he would recover from so fast that it rarely interrupted his workflow. And there's a number of carpenters and people that do construction that I work with here in the practice. Now, if this sounds like you and you'd like to unpack this further, again, just message me. And so we can set up a conversation where we can talk it down. Now, when we come to the upper extremity, I thought this study was really fascinating. What they found is, this was in the British Medical Journal in 2018, they found that there was an association of grip strength with all causes of mortality, including cardiovascular, respiratory, and cancer outcomes. So if you lost strength in your grip, in your hand, it actually was a sign that you were losing function in your body overall and your ability to even recover from cardiovascular, respiratory, or cancer challenges. And they did this study on 500,000 UK participants, and they had clear evidence that showed that low grip strength is associated with a range of poorer health outcomes. So it essentially said, you lose that grip strength, you're heading towards earlier death. That's what it showed us. Now, there's another study, and this is the actually another study that showed improvement in motor function, measuring grip strength following chiropractic adjustments to reduce vertebral subluxations. And so they actually did find that when correcting the subluxations, there was a recovery of that grip strength. And so if it recovered the grip strength, might that also be by association? Could we also say, oh, that might actually be prolonging life? Because if you have better nerve supply to let me explain this. The reason why this BMJ study showed, like, you might wonder, why would that be if you have less grip strength? Remember, the nerves that come out of the neck that control the grip, those nerves also are controlling the cardiovascular system and the immune system and all the systems in our body. All the nerves are coming through the neck and going out to the body. and going down the spine and further out to the body. So if you have trouble in your neck with chronic subluxations, then that can actually be associated with affecting your quality of life, but perhaps also the length of your life. And so the chiropractic care that improves the strength of the grips, there's also studies that show that it improves immune system function, it improves cardiovascular system function, and so we can actually extrapolate it from there. All right, growing old, not for sissies, but don't let them tell you that there's nothing that you can do about it, that it's just growing old. No, if they start to tell you that, just kick them in the shins if they do that. We need to just take action. So success is reserved for the action takers. So if you're watching this, it tells me you are an action taker because you've taken the action to get onto this video. And so I'm glad you're here. And so let's unpack this here. So what are the things that you can do to bulletproof your shoulder? I just want to go through a few exercises. Again, these ones I find are the most useful for the broad range of upper extremity issues. And so specifically for the shoulder to start with. Now, everybody knows what a push-up is, but when you're doing a push-up plus, what that means is you're going to actually hands on the floor, lock the elbows, and then you're going to still lift your torso up and down in the shoulder. So you're going to raise up the shoulder, so you're lifting the whole shoulder up, and then you're going to let it drop down a few inches, but you're going to be keeping your elbows locked the whole time. For the wall angel, and again, just the muscle that's being worked here with the push-ups plus is the serratus anterior. That's that muscle that's highly defined in boxers that you see right underneath the arm, the side of the chest. So again, you're going to hold your arms out in front of you, and as you're doing either a wall push-up or a floor push-up, and then moving the arm back and stretching the arm out, and then letting your shoulders drop down. So you can do wall push-ups, you can do them leaning into a chair, but all of it's going to be done with the arms straight, and of course you can do it on the floor. The wall angel is where you're going to lean against a wall with your butt and your back against the wall. You're going to raise the back of your hands and arms against the wall and lift your arms up and out while you're keeping the back of the hand and forearm against the wall. So this is what's going to help the rhomboid muscles, which are those muscles right in between the edge of your scapula and your spine. So the inside of your wing bones back there, the scapula and the spine, that's where the rhomboids are. So the wall angel is where you're going up and down. Now go cautiously here. You don't actually have to have too much of a range, and you're still going to get benefit. The third one is the reach, roll, and lift. Now this one, you're going to start in child's pose, and then you're going to reach your arms out in front of you on the floor, and then you're going to roll your palm up. So you're going to roll it out, and so your palm is up, and then you're going to, just keeping the arm straight, you're going to try to lift it off the floor, and it's only going to go a few inches. But it looks like you're hardly doing anything, but it's a hard workout. And this is for the lower traps. And the lower traps are, when you think of your traps, it's right around the top of your shoulder. Like if you raise your shoulder up to your ears, that's where the traps are. But the lower traps are going down into the scapular region. So each of these exercises, you can do 8 of each at a time. Now, if you want to bulletproof your arm and your hand, these are the exercises for that. You can get a rubber band and put it around the fingers and then open the fingers up against the tension. Pardon me. You're using your extensor muscles, and you're just going to stretch it. Now, when you start out, don't use a really thick rubber band. Use a very thin one to start out with so that it's just easy for you, and then build it up as you go. For the flexors, well, we all already grip a lot of things, but if you really want to build them, you can just use a tennis ball and squeeze it. And that's a great way to bulletproof your hand. And again, do 8 reps of these as well. And now if we look at the life extension exercises, I love these exercises. They're so good for the extensor muscles in the spine. And so we talked about how a lot of upper extremity issues are because we lose that extensor tone in the back of our spine. So the way we do this, it's going to help to strengthen, and this is actually going to extend your life because it's going to keep your spine healthier. So just like we brush our teeth to extend the life of our teeth, and how often do we brush our teeth? Twice a day. So you want to do these life extension exercises twice a day as well. And I even do them when I'm brushing my teeth because that's something I already do twice a day. So I just add these to it, and it's very easy to now incorporate a new habit if you can link it to a habit that you're already doing. So we use the acronym YWLT. We use it, the acronym of You Will Love This. YWLT, you will love this. So for the Y, you're going to hold your arms up and out and then stretch them further up and out. So you're going to really be like working to stretch your arms and your fingers towards out into the universe. You want to hold them for 20 seconds with deep breaths, and you're just going to keep checking your head posture so you're in a proud posture. Then for the W, you're going to drop your elbows down towards your back pockets. So imagine what it would be like if you could, with elbows bent, try to stick your elbows right into your back pockets. That's how you're going to work it. And you're going to, again, do deep breaths with your head proud, looking out at the horizon. And then at the end, just push them even a little further toward the back pockets. Then for the L, you're going to drop your forearms and pull your hands back so that they are in an L shape with your upper arm against your side and your lower arm perpendicular to your body, so sticking out to the side. And you want to actually pull your hands back so they're out of your field of vision as you gaze out at the horizon. So you're going to be squeezing your scapula together, squeezing your wing bones together, and your elbows are bent and your hands are going out to the side towards the back. Then the T is going to be stretching the arms out straight to the sides, away from your body. Again, in that proud posture, holding it for 20 seconds with those deep breaths in each instance. And if you want to get a summary of all these exercises from the webinar, just send me a message and we can email them out to you as well. Now, this one's also a good one, which is hanging around, as we say here. So I have found that if you can find some place that you can, whether it's like a chin-up bar or even just the frame of a doorway, if you stretch up high and just have your fingers grab on and just let your body kind of drop down a little bit so you are feeling a hanging motion of tractioning the shoulder. And if you actually have like a bar, monkey bars, or something that you can actually hold on to and let yourself just hang, just starting out with like 20 seconds or so, but each day maybe adding another 10 seconds. And if you can get up to just hanging for a minute, it's really amazing how helpful that is for the shoulder in just tractioning it out. So again, it's for kids that are on those monkey bars, but it's also for you Spartan athletes that are doing these workouts. But for anybody with shoulder concerns, hanging is actually a very useful piece. And then we have the lower anatomy. So let's look at the lower extremity. And what are we including here? So it's going to be a closed kinetic chain, the lower extremity is. And as a closed kinetic chain, compared to the upper extremity, which has more of an open socket, it gives more mobility and less stability. A closed kinetic chain means it's more of an enclosed socket in that joint. And that's going to provide greater stability, but less mobility. And then, of course, you have the knee, the foot, and the ankle below. So if we start with the foot and work our way up, we again want to look at biomechanics. And so some downstream symptoms from upstream problems, subluxations, we might have some low back pain, but we might also have any of the lower extremity having some pain. The lumbars are what are controlling that whole lower extremity. So the entire body from the top of the head to the L5 sits right on top of the sacrum. And so we call that the sacred bone. So you can see the lumbar spine sitting right on top of the sacrum, this triangular bone in the middle between the pelvic bones. All the weight of the body is sitting right on these two joints here. Now, if someone were to, here we go. If you're someone that loves struggling with symptoms, of a lower extremity issue if you love it, right? Yeah, I'm sure you don't, but maybe you know somebody that is struggling with it, someone that you love. So look at what we're looking at here for an example. So you have your hip, your knee, your ankle, and foot problems. And so if you are struggling or someone you know is, then you're in the right room right now because I want to go over what are some things that I find here and how do we get to the bottom of these. And again, understanding the real causes is the key. So most importantly, what can you do to avoid these problems or what do you need to do to correct these issues and get back to life? If we look at the lower extremities, and sometimes we talk about people that are just like they've got these chronic injuries, these nagging injuries, and they just feel like they're falling apart. And so we call this adult onset FAS, adult onset falling apart syndrome. And so basically, again, most of these things are correctable so we can get you back in the game. And so when we look at knee problems, oftentimes downstream from the knee problem is the sacroiliac joint subluxation and altered gait that is actually wearing down the knee. So if you have the pelvis, what we call an internal ilium, if the pelvis is rotated, it can actually cause an outward foot flare. So when you're walking, your foot is flaring outwards instead of being straight in front of you. And that often is going to cause medial meniscus problems or medial collateral ligament problems in the knees. If you have an external ilium, that's going to cause external knee issues and lateral meniscus and lateral collateral ligaments trouble. So, if this sounds like you and you want to unpack this further, again, just feel free to message me. Send us a message to our text 802-985-9850, and we can talk it down. When we look at the foot, in our office, we actually do a digital analysis of the foot so that we can be sure that there are no biomechanical faults in the foot that are then going right up the spine and causing problems. So when we look at the foot and how you're standing, we can actually evaluate it. When we look at a healthy, normal foot, the surface that you're standing on, what is red here, the heel, the ball of the foot, and the toes, the red part is what should be touching the surface that you're standing on. And so we should have an arch that's coming away from what you're standing on that comes up in the medial foot, the center of the foot, and the lateral part of the foot. So we should have our 3 arches right through here between the heel and the ball of the foot. That's the healthy normal. When we do our assessment, we may find that somebody has lost that integrity in their lateral arch, or maybe they've dropped that medial arch, or maybe they've even lost the metatarsal arch as well. And so by evaluating that, we then can see how what's happening in the feet can actually go all the way up the spine. So when you have a healthy, normal foot with good integrity in the arches of the feet, when you stand with equal weight on both feet, when you look straight ahead and you can achieve that, we're going to have the proper distribution of weight on the knees, on the hips, and on the shoulders. So with your gait, every time you walk, everything's going to stay in a healthy state when you're balanced. But if you're imbalanced, we might see the arch dropping. That's going to affect the knee, which is going to affect the pelvis. It's going to tilt. We're going to see shoulders dropping. And all of this could actually come from a loss of integrity of the foot. So in order to address that, we want to definitely make sure that there's no subluxations in the spine that are leading to a impaired nerve supply down into the foot that's causing a loss of integrity in these arches, in the muscles that support them and the ligaments. But we also may need to actually put the anatomically correct inserts under the feet. So having custom-made orthotics that are going to support this person and what their faults are so that they have the right support under all 3 of these arches. Once they have the right support and we can get that balance back, then we're going to take that extra stress off of the ankles, the knees, the hips, and the shoulders, and we're going to get back into balance and back into good function. Now, going up from the feet, we can go all the way up to the spine and see where are the spinal problems that tend to lead to the hip, knee, and ankle problems, and even down into the feet. And it tends to come from this L3 to L5 area and the sacrum and the sacroiliac joints. And so it's this whole lower part here in the bottom of the spine. So these are the common levels of subluxation for people that have lower extremity issues. Now, what are some of the self-care things that you can do? Well, when we talk about self-care, foam rolling is, many people know about foam rolling. And for the bottom of your foot, you can just use a golf ball to roll on, or you can freeze a water bottle, a little, pint water bottle, and that you can roll your foot on that as well. That can be really useful, just breaking up adhesions and getting more flexibility into those tissues in the bottom of the feet. But other than that, you can use foam rollers. And I actually like this particular style of foam roller. This brand is called the Proper Roller. I like it because it's contoured, so it makes it more stable. And so whatever body part you're using, for example, if you're working on that IT band, the tensor fascia lata right on the side of the thigh, you can actually fit your leg right in there, and those knobs are going to do that work. Now, I find that it can be, you can try to be sophisticated and do the tricky part of rolling, which is where the word foam roller comes from, but I find it's equally as effective to just let the weight of your body just rest there for 5 breaths, and then move it a little bit and have 5 breaths in the next place. And the tender spot is usually the right spot, so you can actually engage in a very specific way with it. But foam rolling, it's kind of like brushing your teeth, and chiropractic care is the flossing that happens. So again, lie on it, take 5 breaths. Now, icing is also something that people use, but I should just caution you that the most leading edge research actually says that icing may not be best in an acute injury. It actually may slow down the healing process. And then the other part of self-care is going to be exercise. Now, some people are also familiar with vibration and how that can be useful in any of your self-care. And so we actually have a proper roller version that actually has vibration in it. And so you can actually do the foam rolling, but then you can turn on the vibration switch. And that vibratory frequency actually adds so much accelerated function. It actually improves the strength and the recovery and the blood flow by just adding the vibration to it. It's really good for bone density as well. So that could be a tool that you could use. Just stop in at the office and ask us about that. We can show you that. Another part of self-care, again, is exercise. And I wanted to introduce you to another technique, an approach that I have found really useful. It's called total motion release. And it really is phenomenal how it works. I'm just going to refer you to the fellow that created it. So if you go to YouTube, you can check out total motion release. And he has all kinds of exercises for every extremity joint. So whatever you are struggling with or you want to be proactive with, especially when you find that you don't have it, when you have asymmetry. So if you can like raise your shoulder up really high on one side, but you're more limited on the other side, or the same thing if you have asymmetrical levels of flexibility or strength, I would recommend you check out this total motion release. And it actually seems to work at a brain-based level. And so it's counterintuitive because if you have trouble with one shoulder, let's say your right shoulder, with the total motion release approach, you actually are going to be working very strongly the left shoulder. And you're going to do with the left shoulder the exact motion with vigor that you wish you could do with the right shoulder that has restrictions or pain or where you're having trouble. And you just do this persistent work 20 times vigorously, strongly with the opposite side. And then you just check in one time on the injured side or the restricted side. And you may notice without doing anything more to it, it suddenly has a bit more motion and a bit more ease. And so if you do find that, then you want to continue to repeat the opposite side, working that strongly, 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 and just checking in as it actually helps the injured side recover. Again, I'm going to I'm going to recommend you go right to the TMR YouTube videos for the instruction there, total motion release. But it is really phenomenal. I love that it's working. It seems to be working at a brain-based level, which is what we do here in the office, is work at the brain-based level for correcting subluxations in your spine. Now, the other part of self-care is going to be lengthening, and which is going to be all about stretching, and strengthening, which is going to be all about the workouts. So these are polar opposites. And I actually want to share with you a quote from Seth Godin that I loved, because it applies to more than just your extremities. You will see how it applies to life. And he says, with stretching, there are two polar opposites: staying still and breaking. And it's easy to visualize each end of the axis, whatever the activity. So thinking about the exercises or the workouts that you're doing, where you just do nothing at all, or you do it so much that it breaks. And so in between these two extremes is stretching. Stretching is growth. We're extending our reach. We're becoming more resilient, limber, and powerful. Stretching hurts a bit and maybe leaves us just a little bit sore. But then tomorrow we can stretch further than we could yesterday, because stretching compounds. If you're afraid of breaking, the answer isn't to stay still. No, if you're afraid of breaking, the answer is to dedicate yourself to stretching. So I love that. And so when we talk about self-care with stretching, like if your right knee, if you're one stretch you can do is again for the lower extremity. If you bend your right knee and then put your right foot, the top of your foot, put it on a chair behind you. This is a good quad stretch. And then another one would be having your left leg forward of your right, and then sliding your hips forward for more stretch. So this is like a lunge. And then if you were going to be advanced, you actually could grab your foot behind you and stretch it to have your heel hit your butt. Again, but the easy way to do that is just to put your right foot on a chair behind you. For your hips, around the clock lunges, I really like. And so that's where you're standing. Your toes are in line with your nose. You don't let your knee go past your toes as you lunge forward, and make sure that your knee is tracking in the midline and doesn't stray medially or laterally, doesn't stray internally or externally. It just stays right in the center, right in the midline. And then just lunging forward. And then you can lunge backwards. Then you can switch legs. And you can also lunge out to the side and then back and then switch legs and so on. So you can just do either side like that. So doing that a few times a day is really good for your acetabular joint, your hip joint, and your sacroiliac. And if you're too sore to do that because of an injury, then you can actually just simply hang your leg, like stand on the edge of a step and have one of your legs just hanging down over the step, and just hang it and move it in kind of figure 8 motions a few times. And that can be really great for that acetabular joint, that hip joint. If you want to be advanced with these kinds of lunges, you can use a wobble board for your lunges. And that way you're incorporating a lot more in proprioception, and it encompasses a lot more of the muscle as you do that. If we're talking about squats, again, a good squat is so important. Remember, your toes need to be in line with your nose, and your toes are up, so your weight is on your heels. Remember, the knees are going to be tracking over the toes, but never in front of the toes. You're going to use your glutes when you're lifting. It's the biggest muscle in the body, and we don't want to just sit on our glutes. We want to lift our tailbone up and use our glutes. If you're unsteady with your squats, you can do them in a door frame. So right where, if you open the door and just stand in the door frame, you can actually use that for support. If you're not doing it right, it's important that you do it right before you do it vigorously. So just get your technique down first. Once you get the technique down, then if you can do 10 of these correctly, you're going to feel it the next day. And you might be using the handicap rails in the bathroom when you really work these out. So You know that feeling of really getting that burn going. Now, for those of you that are wanting to look for what's the edge where I can get even more performance, or if you're concerned about injuries and you wish you could do the vigorous exercise that you had done when you were younger, but you're not sure your joints can tolerate it, then there are other hacks, body hacks that you can do that can go around this. And so one of these body hacks is something called BFR bands, blood flow restriction bands. And the company that I like is the B3 Sciences company. And so what they are they are these bands that you put around your upper thighs and around your upper arms, and then you just do your workouts. And when you're doing your workouts, because it's restricting very safely, it's restricting the blood flow, your brain perceives it as though you're doing a much more vigorous workout than you're actually doing. And then, as a result of that, the brain is going to start secreting all of this nitric oxide and the brain-derived neurotrophic factor, which is so important for learning, and the human growth hormone. It's the most important anti-aging hormone we have. And so as you start to secrete these, it actually helps with the lining of your blood vessels, and it helps with muscle recovery, and it helps with bone density. So across the board, cardiovascular health, all of these things are benefited by the body being flooded with the nitric oxide. And if you use this QR code, or you can see at the bottom of the screen, the website, you can type it in if you want, wellspringcls.prob3.com. And it takes you to a website that has all kinds of videos and information, including the science behind it. So if you're curious about that, please, I encourage you to go check that out. You can also ask us questions right here in the office. And I love these B3 bands. I've noticed a significant advancement in my own strength and flexibility and my ability to just perform at sports without really doing a lot more than what I've already been doing. So I was personally blown away by it. I was able to jump in with a bunch of CrossFitters, and I don't really use CrossFit very much myself. I use other types of exercise, but I just jumped right in. I was doing those burpees and push-ups and jump squats and all of those. I just did a workout, and I was amazed at how much strength I actually had to do those things. And all I had added in was using the B3 bands. For me, I use it like when it's time to bring the wood in the winter. I put the B3 bands on and get some vigorous exercise, just bring the wood in. So you can really use it with very light exercise, but you get the benefit as though you've done vigorous exercise. It's really quite incredible, this technology. Now, what about the traditional ways of dealing with sports injuries, extremity injuries? The allopathic options, or the conventional medicine options, tend to be using heat and bed rest is a very common thing, and using drugs to treat them, and physical therapy and steroid injections and pain management, and then it goes to surgery. So I want to just go through and unpack these a bit so we can see, is this a good option or not? And the question that really you need to ask yourself in any of these situations is, because I have patients that come to me and ask me, Doc, should I take these drugs? Or Doc, should I get this injection? And so I have to just say, I don't know the answer to that, because I don't know what your goal is. And that's where you have to get clear for yourself. What are you trying to accomplish? If you're just looking for symptom relief, if that's your goal, well, any of these approaches may be useful. But what if your goal is, I just want to have a successful outcome? What if I want to get back in the game? What if my goal is to be healthier? So better questions are, instead of asking, should I take this? The better question is to ask, what's causing my problem? Can it be corrected? How can I correct it? And then by looking at the options, you want to ask yourself, to evaluate each option, what is the safety and the efficacy, both short-term and long-term results with any of these options? And so let's just take a look, because if your premise is just about, I just want to, just this pain to go away, it may lead you to the wrong approach. And if you're looking at more of a vitalistic approach, a wellness paradigm where you're actually healing and getting healthier, then it's going to lead you in a different direction. So for example, heat and bed rest is often recommended. Well, whenever there's tissue damage and it creates inflammation, if you have a problem with that inflammation, heat might relax the muscles, but it also can be a vasodilator and it can also increase chronic inflammation at times. So it may not be the best option. Bed rest, well, that's kind of a bad idea. I mean, initially, if it's an acute injury, 48 hours of rest is oftentimes a good idea, of course, so you don't just injure that newly injured tissue. But then it's usually best to just get up and start moving. And remember, when you're not moving, imbibition is stopped. And if you don't start moving, that's going to lead to degenerative change in your discs and in your joints because they're not getting the nutrients in or the toxins out. And that's also going to lead to muscle atrophy, which is just going to be a downward spiral. So bed rest is not always the best option, especially once you've passed 48 hours after an injury. Now, the drugs, well, drugs cover up symptoms. And those symptoms are body signals. They are the alarms, the warnings that your body's trying to tell you to stop what you're doing because you're injuring yourself. Now, one study showed that just for pain relief alone, not looking at actual tissue improvement, but just for pain relief, 58% of people felt that drugs were effective, 54% felt that chiropractic was effective, and 48% felt that PT was effective. So they're all pretty close to the same. But what was the difference in the safety and side effects and the long-term efficacy? Because they come from different premises. And so just recognize that when we look at it, we want to look at both safety and efficacy. Now, physical therapy, that can be excellent for treating soft tissues surrounding the problem, but most of them are, we have to just address what the real problem is. And if that's structural and neurological, if that's what the real problem is, where the motor unit has damage and derangement, the PET might be helpful if it's recovery oriented and rehab oriented, but not so much if it's just for symptom management. That's what we found. So if you're working with a PT, make sure that they are focusing on the goals that are associated not just with it feeling better, but with it actually functioning better and restoring that function with recovery. Then if we look at steroid injections, they may be a very powerful anti-inflammatory, but they are dangerous and they can lead to long-term joint damage. They can literally, they're so aggressive that they can achieve the pain relief short-term, but they actually can set up the joint for long-term instability because they can be breaking down the very tissue that that you want to be healing. It can actually break that tissue down. So you're basically trading acute pain for chronic degenerative problems. And that can lead to long-term damage for the synovial joints and long-term instability, and it can really compromise the whole stability and health of the joint. Now, when you get to pain management, by the time you're looking at just pain management, people are desperate and they're not addressing what the cause of the problem is. And again, go back to safety and efficacy. The most conservative way to approach it is going to be the very best way to start from. And we already see that the most conservative approaches may be at least equally effective and safer than drugs and surgery. And what about the cost effectiveness, right? Way cheaper. And what about adverse outcomes and risks? And then what about the addiction issues that come with pain management, with opioid use and so on? And Vermont, we've been hit hard with opioid addictions. And then what about surgery, right? So again, surgery can be it can be tricky. I actually had a patient who he was in pretty good shape, but he did have trouble with a knee, a chronic knee injury. And he was convinced that if he got the surgery sooner while he was still in good shape, that he would recover from it faster because he was already in good shape and that would be the best way to go. And so he went and did have the surgery. He died in surgery. The anesthesia ended up killing him. So that was not a good outcome. So surgery, it's definitely the adverse outcomes that are potentially there, just how invasive it is and that your outcomes may not be good. I've also had people that have had hip replacements and knee replacements and had good outcomes. So again, you just have to weigh the benefits and the efficacy and the safety as part of that. Now, if we look at alternatives, so this is the conventional way when people start to get degenerative changes in their joints, and it's for arthritis relief. And we call this non-steroidal anti-inflammatory drugs, or NSAIDs, NSAIDs. And this is the most common choice for symptom relief. So these non-steroidal anti-inflammatory drugs, they are able to alleviate inflammation, but they may actually damage cartilage. And people think that they're over the counter. They think, oh, it's safe. But actually, 16,000 people a year die from the use of NSAIDs. And 10% of drug-induced liver damage is caused by just over-the-counter use. We also have found that it can damage your kidneys, and they actually have a lifetime limit. Studies have shown that there's a lifetime limit of how many of these NSAIDs you can take. And if you take 1,000 over a lifetime, you actually increase your risk of kidney damage by eight times. And if you take 5,000 in a lifetime, chances are you're going to be dying from kidney damage. So it's actually a very important thing to consider, especially athletes tend to use this, and sometimes they get into a chronic use, and then you're in trouble. So who here would actually rather just find a natural approach? Because of all the side effects of all the drugs, 10% of those side effects are coming from NSAIDs. So it's very common. If you're looking for a natural approach, these are some of the tools that I use in the office when we're looking for supplementation. And supplementation, again, is going to be looking at how do we actually bring the building blocks that the tissue needs in order to have that optimum repair. Now, for acute joint injuries, like within the last 30 days, I find that Ligaplex 1, Boswellia, fish oil, and Gotu Kola are the ones that I go to for addressing acute injuries. For post-acute injuries, meaning more than 90 days, I switch people to Ligaplex 2 and then continue with the Boswellia and the fish oil. We also have a very good turmeric product, and that can be very useful with the inflammation, taking down the inflammation in extremity injuries. For long-term joint support, glucosamine synergy, continuing with Boswellia and fish oil, and also MSM can be useful. Now, many folks nowadays are also exploring hemp and CBD for inflammation and joint pain. And I have tested so many different brands. Again, in the last few years, when CBD use has become much more widespread, especially here in Vermont, lots and lots of local companies have come to me to give me samples that I can test. And I just have to be straight with you that there's very few of them that tested very strong. I'm not sure the quality is always consistent in some of these products. The ones that tested most consistently, the strongest I have found, are the standard process hemp oil complex and then the Hygieia CBD complex. And again, the turmeric and Boswellia are also very useful for other types of sports injuries, which we'll go into in a little bit, which is concussions. So that's that extremity above the spine, right? Not the arms and the legs, but the head. So I'll share that with you in just a moment here. Now, when we talk about concussions, again, this is something that has gotten to the news more in the last few years. And I'm actually part of a national organization of chiropractors. And we work with we are called the Wellness Champions, and we work with lots of professional and elite athletes in our group, pro athletes with the NHL, baseball, NBA, NFL. And these people, yes, they do have head-on collisions that can lead to concussion problems. And those concussion problems can go far beyond the brain. So I wanted to share some of the data about this here. First off, 1 in 5 high school athletes actually experience concussions. And women actually also are exposed to concussions because a lot of the female sports They may not have as much collision, but they definitely are contact sports. And so they can also have concussions. Lacrosse, volleyball, basketball, for example. 6 out of the top 10 sports have head injuries in women's sports. So when we look at concussions, there are 5 million concussions every year in middle and high school. So this is happening in younger and younger populations, the ages 10 to 14. So when we think of the concussions at the professional level, there's twice as many concussions that happen in high school compared to college. And at the professional level, there's half as much as college. So as you get more and more sophisticated in your athletic abilities and your competition, you have less concussions, but they're not gone. And so we have to pay close attention to the middle school level because there's a lot of concussions showing up there that may be getting overlooked. 1 in 5 players will have concussions by the time they leave high school, and 33% happen during practice. So oftentimes, the athletic trainers and the MDs and the PTs are there on game day, but they may not be there during practice. And sometimes there's a lot happening at practice. There's drills that are happening in different groups, and sometimes it may get overlooked that a concussion may have occurred. So again, really important to recognize that when no one's around, those concussions may be happening. And even the coach may not be paying attention. It's not anybody's fault. It's just there's a lot going on. So not blaming anybody, but it can be budgetary problems that are happening there as well. There's a few different things also. When we look at contact sports like basketball, there's no headgear. And yet defensive players are taught that when enough offensive player is coming down the court for a layup, they're supposed to take a stance and hold it, take the charge, and sacrifice their body to get plowed into. So charges can happen in these sports like lacrosse as well. And they can even have head-to-head contact in these sports. So contact and collision, don't think that it's only football where there's a problem with concussions. Many of the traumas in every category, it's not just football. And also, there can be whiplash that happen in these injuries. And when there are whiplashes, there can be 4 to 10 G's of force with whiplash type of injury. So concussions, they may have, concussions can have over 90 G's of force, but even 4 to 10 G's of force can cause whiplash, which can injure the upper cervical spine. And that can actually have a lot of similar concussion type symptoms. And there's a lot of ambiguity on how concussions are being identified. And sometimes athletes are being kept out of play. They're not sure whether they're ready to return to play or not. They miss playing time when they don't need to because of the ambiguity that's there. And 70% of high school athletes, they played even though they had the symptoms of a concussion, they still went in. And second concussion syndrome, that takes 18 lives per year at high school level. So that literally is killing some of our high school athletes. And that's where you have one concussion, you sit out for a period of time that wasn't long enough, you go back in, and then you get the second concussion that damages the brain further. And that's really sad when that happens, just because it wasn't identified properly that they were ready to go back into play or not. Now, when we look at use of medicine by the AMA guidelines, if you were to have a concussion, and the medications were used for treating the symptoms, that is a problem because we want to avoid medications that are going to mask declining symptoms or that are going to mask the alteration of mental status because we need to know if they are deteriorating. So it's not actually recommended to use medications when there's been a concussion. And you want to be very cautious using NSAIDs because they can actually increase the risk of intracranial bleeding that occurs. So sometimes there's a headache from concussions and people think, oh, I'm just going to take this, Tylenol or Motrin or, all these ibuprofen, like I'm going to just take these to try and treat the symptoms, but you actually could be increasing risks. So moms out there that are trying to take care of your kids, right? Don't misunderstand that giving Tylenol or Advil after a concussion can lead to more damage. And ibuprofen as well can create intracranial bleeding and make problems worse. So there's really no medications that are available to treat concussion. You just can't take the drugs and be safe at the same time. And so there's got to be some other way. There's got to be other ways we have to address this. And so this research showed that they found that athletes who suffered a concussion, listen to this, they were 3.79 times more likely to get a muscle or ligament injury. Why is that? Why would you think that was something that was part of concussions? Well, it turns out that when you have a concussion, including the upper cervical subluxations that can be that are associated with concussions as well, what happens is the signaling between the brain and the body, it either becomes more vague or less precise or distorted. And that means that the brain's getting information from the body that may be inaccurate, so that the information of where your body's in space may not be accurate. And so these athletes that are jigging and jagging as they're running and performing, they may jig or jag, and their brain thinks their knee is in one place, but it's actually not there. It's in a different place. And that can then spring into ACL ligaments or injuries, for example, that increase 3 times more common when somebody has a concussion. So play after concussion, again, 3 times greater likelihood of ACL and meniscus tears in the knee because the righting reflex is wronging you. There's also an increase in risk of Tommy John surgery in the shoulder with throwing sports. If there's been a concussion, there's a false diagnosis of autoimmune diseases. So it looks like people suddenly start to have leaky gut. And that's because of the inflammation in the brain, and we can get leaky brain at the same time. And so it can really give people trouble. So if people suddenly have GI disturbances after a concussion, yeah, it's something that we need to pay attention to. And that can lead to autoimmune diseases because of that. There can be fascial adhesions, which create strain in the body. And then we've talked about that second concussion roulette that can happen, where people go back into play when they haven't healed from the injury yet. Other places where concussion is in the news is that kids' concussions go underreported. And we now have longitudinal studies from the AMA that after one head trauma, we see a decrease in grades in children. And they're underreporting it in kids that a single concussion can cause lasting damage to the brain. Decrease in grades means they're affecting their SAT scores, and that can affect their likelihood of even going to college. And so if they're thinking of a sports career in college, concussions in grade school and high school can actually interrupt that path that a child is on as they grow in their athletic abilities, but it may actually be affecting brain function and their performance in school. A single concussion can cause lasting damage to the brain, the study finds. And after concussions, kids face persistent difficulties with school. Head injuries can have long-lasting effects, not just on the field, but in the classroom too, leading to the poor grades. So we have to have a baseline test, and that's a way that we can recalibrate after injuries so that if we have that righting reflex, we want it to be working. And after hard, serious injuries, we may see that leaky gut. We may need to retrain the eyes in order to fully restore the brain. And so we do some of that testing right here in the office so that we can be monitoring that. So if you're not already working with somebody that's watching that, then let us know. We can actually do some testing on that too and monitor that so that we can see that you are progressing in the right direction. Now, when we come to addressing the cause and correcting the subluxations, chiropractors correct the interferences between the brain and the body so you can heal from the nagging old injuries and you can protect yourself from chronic deterioration of future problems. The studies actually show that there's increased cortical activity after adjustments. So when you get adjusted along the spine, we can see that the brain actually has increased activity, and it leads to increased strength after the adjustment. So because the brain got healthier from the adjustment, overall strength actually improved in the body. So chiropractic, it turns out, is a lifestyle success strategy for healthy human beings, not just for athletes. but it can be just a way for you to be more adaptable to whatever stresses you are encountering. So again, this is what happens with subluxations. We have the joint misalignment, we have the soft tissue damage, the inflammation that leads to nerve irritation, the muscles spasming around that joint, causing that lost inhibition and that joint fixation, which then can lead to chronic sports injuries. So how would you know if you have a subluxation? We measure that in objective ways. So we do instrumentation right in our office so that we can determine how your nervous system is dealing with stress. And the instrumentation shows us also what's happening in the nerve supply to the muscles, the nerve supply to the blood flow to those muscles, whether there's anything that could interfere with the healing of an injury. We look at motion palpation of the spine. Are the joints moving properly? And static palpation, is there actually twists and turns in the spine in the alignment? We do the posture analysis, so we make sure that when you are working out, it's going to be healthy. You're not setting yourself up as risk for injury. And the x-rays will show us not only where the misalignments are and whether there's any degenerative change, but if there is degenerative change, it helps us to age how long you've had the problem there, and then what is it going to take to correct it. And so in our office, we use a three-legged stool model of correction. We want to train you on how to break the bad habits that have gotten you into these troubles, and also add specific exercises in for the individual to get their spine stronger and to get their joints stronger and rehab their joints. And we use chiropractic adjustments so we can clear the interference so that your brain has an accurate picture of where the body is in space, an accurate picture of what is happening in those extremities, so that it can then give the proper response so that your body can readily and appropriately adapt to all the ways that you are exercising and participating in your sports. I want to just finish up with this story of a patient in the office. Frank, he came into care and he says here, anyone looking to solve health issues and avoid medications, he recommends our office. So he had been seeing us for many years, and his successes were beyond his expectations with many of his health issues and injuries. We actually were able to prevent him from having to have a costly knee surgery 8 years ago, and he's had no problems since then. And so he appreciates that. And I will tell you that many years have passed since then, and he still was able to avoid any further knee surgeries as well. Another patient, she said that before meeting us, she had stopped her daily walks and had had so much pain in her right foot. She also had pain in her neck and shoulders and her upper right arm. And then after seeing us, she now is able to walk daily again. The pain in her neck is gone. She's able to use her right arm that was limited. And she's learned to listen to her body. And now when something is off balance, she says she's able to make adjustments to change the situation, and says without our care, she would not have been able to enjoy life again. She calls us her hero, and she loves our staff as well. And in fact, when she got under care, she was actually afraid she wasn't going to be able to make a shopping trip at Christmas time on a bus that she usually used to go on every year. She'd take the bus over to New Hampshire, I believe, where they would visit the outlets, and there was a lot of walking, and she didn't think she was going to be able to do it. Well, not only was she able to go on that trip, but she actually was able to start snowshoeing that very same season, which was way beyond she ever expected. I had another patient who had knee trouble, and he, in fact, just finished second place in a golf tournament, and we were able to help him with that knee. So how would you know if you had subluxations? Again, this is how we measure it. So if you have not had this measured, if you have not had your spine checked, then you need to get it checked to find out whether or not anything is going on in the spine that could be actually affecting what's happening in your extremities. So we would be checking the posture, looking at the moving parts in healthy alignment to make sure that you can last longer. I mean, you ask any mechanic, if something's out of alignment, it wears down faster. And so it turns out that if you have a high right hip, you have an imbalance in the pelvis, it means you're putting 15 more pounds on the other side. And if you're doing 10,000 steps a day, that's 150,000 extra pounds on top of the regular body weight in a day. So recognize that this is something that is cumulative. So we have to correct it if we're going to be looking at long-term agility, strength, flexibility, and function of all of your joints so that you can stay in the game. Remember that procrastination is the thief of health. And so the most common thing I hear people say is, boy, I wish I had known about this sooner. And so, for 40 years, every week I hear that comment from somebody. So if you have old injuries and you're thinking the same thing, yeah, what if I had taken care of this sooner? Then make sure you do come in and get checked. And it's because of this that we're on a mission to check as many people as we can so we can get them the help that they need sooner rather than waiting until it's too late. And so we do need your help too. So if there's anybody that you know who is struggling with this, friends, family members, neighbors, maybe coworkers, just share this video with them and invite them to come and have a chat with us and see whether or not we can help. We'd love to see if we can help. All right, so again, thanks, and make sure you reach out to us. Our text is 802-985-9850, and we look forward to hearing from you soon. All right, so I'm going to stop the share here, and we will also stop the recording because we're going to finish up for tonight. And anybody that's left on the call live, I'm happy to answer questions. So thank you, everybody, for watching, and reach out to us to see if we can help.